again, in this situation, and you covered things very well in terms of describing what you saw with him, but organization was needed a little bit more. Brock started with talking about skin findings before you started talking about the physical examination.
Right.
And we need to, again, do the segues from one system to the next so that people can be a little bit more clear. Again, as I said to the first group, I like to start at the top and work down, and that way I remember to try to catch everything in between so I don't forget. One of the things that's always helpful, of course, is if you bring a diagnostic kit to a clinical rotation like this. And I guess I'll stop there, except to say that with his heartbeat, it wasn't just irregular, but it was irregularly irregular. And that fits in with his history of AFib.
Okay. This is something you can glean just from a physical examination. Do you need any EKG for that?
You can do that on physical examination in terms of hearing whether or not his heart rhythm is regular. If it's beat, 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 beat versus bum 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 bum, bum 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 bum, bum 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 bum, and it just won't have any sort of regularity in terms of the rhythm with it, and that's something you can ascertain on physical exam. And sometimes you may have to listen for a minute or two to make a decision as to what's going on, because this man's on metoprolol, and that will in part help control the rate, the heart rate, and that's going to affect how well you can ascertain whether or not you think he may have AFib based on that. Then again, if the heart rate is too slow, it's sometimes hard to be able to determine whether or not he's having PVCs, and then he